It was my pleasure to introduce Dr. Jim Dunn today to talk to us about the re-engineering of the McMaster Institute for Environment and Health. I've known Jim for many years. He claims I taught him in middle school to make him seem younger or me seem older, certainly at undergrad level, and then as a postdoc and many times since, and we've had great interactions. Jim's work has been largely on the social determinants of health, particularly housing, and he's been doing something excellent interventionist work in Toronto and Hamilton over neighbourhood improvement after the last few years. Was it almost a year ago now that Jim became director of the McMaster Institute, and I think he's going to tell us something about his thoughts on that. Over to you, Jim.
Kind of an opening of a conversation, looking for potential opportunities and so forth. So thanks so much, John, and very happy to be here. And what I wanted to do is kind of walk through the ideas that I've been developing for the Institute. It's been 6 months actually, and I'm kind of in fact-finding mode. I've sort of taken a carte blanche approach to this to say that we might continue to do some of the things that we did before, but we might not. But there are no sacred cows, effectively, in what we're going to do going forward. So let me start. Oh, good, that works. So let me just talk about, this is an outline of what I'm going to talk about. So it's an exciting time. Why have an institute in the first place? I think this is an institute that started almost 25 years ago, and I think it's a good question to ask. Why do we have institutes at the university? It's probably very different reasons than when this institute was started. Many new realities. Talk about the vision that I have, and I've been kind of bouncing off people about a transformed institute, framework for action, opportunities for education and training, interdisciplinarity, and I won't talk so much about funding, but international opportunities is something I'd really like people's input on, because that's one where I feel like I'm not well equipped to go forward. So lots of interesting new insights in environment and health research. There's this new concept known as the exposome, and basically it's the idea of the collective exposure that you have over your life course to various kinds of contaminants and other kinds of exposures. I'm the co-editor of the Journal of Epidemiology and Community Health, and we did a debate about the idea of the exposome, whether it was actually a useful concept or not. There's some interesting work on things like dental lead and Alzheimer's disease. So basically using teeth as a way of measuring lead exposure, lifetime lead exposure, and looking at its relationship to Alzheimer's disease. Issues about the social and built environment as well, which have been, I suppose, less well represented in traditional environment and health research. One of the really exciting things is that I found over the last several years is this evidence of a social or stress mediation of the relationship between air pollution and asthma. And this is actually quite stunning for environmental health research, because in the past, I think it was always believed that there was a single dose response gradient between a given exposure and a given outcome. But it turns out that depending on the level of social stress, even neighborhood crime levels can actually mediate the relationship. So it's a stronger relationship where there's more stress. And so that has huge implications, because essentially it says that the social matters in the way that these things express themselves. One of the other exciting things is that there's a new strategic initiative at CIHR. I think it involves a number of institutes, but it's led by the Institute of Population and Public Health. But they're trying to figure out environment and health research and what that should look like. And I haven't heard too much about it. I sat on a panel about a year ago related to it. And I mean, it was a pretty broad spectrum of people, but nevertheless, I think there's potential opportunities there. In my mind, the Institute, and I've had a long affiliation with the McMaster Institute for Environment and Health off and on, has always had a plurality of environments, and it hasn't been just about the physical environment or pollution environments or anything like that. But I'm suggesting that there's other ways that we can think about environments more than just exposure, right? So for the most part, we talk about exposure to various kinds of environments. And I think there's other opportunities to look at other metaphors, like the idea of affordances. This comes from environmental psychology, which suggests that certain kinds of environments afford certain kinds of behaviors and constrain others. And so that's another possibility. It's more of an intellectual exercise. And lots of policy interest right now in built environments, issues around environmental health equity and interventions. These all represent, I think, the number of the opportunities that exist for the Institute. So, in thinking about why we would have an institute, this particular institute was established in the late 1980s, I believe. You can correct me if I'm wrong, John. In '89 or so.
Martin Taylor was with Toronto.
Yeah, jointly with the University of Toronto. And as I understood it, at the time, the idea was to break down disciplinary silos both within and outside McMaster. And I think, certainly those silos were stronger than they are now. I mean, they still exist to some extent, but they were very strong. And the idea of social scientists collaborating with toxicologists, for example, was fairly taboo at the time. And now I think that at least the idea of doing that is not quite as challenging. Nevertheless, connecting people may still be. I would suggest that any institute at the time would have given scholars pre-publication access to cutting-edge research. That's why you have seminar series and so forth if you're trying to get pre-publication research out. And I don't know what's changed in the world. That part, I can't diagnose the reason for it, but certainly things have changed and people don't seem to come to talks in the same way that they once did. And nevertheless, and in addition to that, you can probably watch most of them, including this one, on YouTube. And so, so many of the things that you might want to see, you're going to see on YouTube anyways. I think there was also, at the time, there was an interest in capitalizing on environmental sustainability. It was 1987 that Our Common Future came out, the report by Gro Brundtland, who had been the former Prime Minister of Norway, and it was the UN report that basically talked about environmental sustainability and really put that issue on the map for the very first time, right? It was something that hadn't been talked about in such grand scales before then. And then I think also at the time, academic knowledge was still somewhat sequestered from broader society. There were barriers to public access and so forth. And some of it was about getting those kinds of things out. But a whole bunch of new realities 20 plus years later. And so many of the barriers to interdisciplinary research I would suggest have been overcome. Support still needed, but conceptually the idea of people across what might otherwise be considered pretty disparate disciplines is not such a challenge anymore. Things like internet, social media, etc. now give ready access to knowledge in a variety of forms. I mean, most people have probably tweeted the results of their studies before they actually hit publication. And we have, online first and all these other sorts of things. Yeah, you never know. Somebody's in your seminars tweeting the results. If you're giving a talk, someone's tweeting the results probably. Societal concern around environmental health and sustainability is well established, but I think it still continues to need support. And there's significant pressure to make research relevant to real-world problems and community engagement, and certainly those are mantras of this university, and I think there's some opportunities there as well. So one of the things I'm road testing currently, and no decisions have been made, is changing the name slightly to the McMaster Institute for Healthier Environments. And there's two reasons for that. One is to make this idea of environment as a plural kind of idea explicit, right? That there's lots of different kinds of environments that this institute would be concerned with. But it also captures a more action-oriented vision. So the idea is about essentially trying to change environments and trying to support different institutions in society that we might have partnerships with and so forth to be more action-oriented about this and to actually create healthier environments. And I know I mentioned this to you earlier on, John, and you suggested that I was kind of going back to the old EP report of the 1986, and not explicitly, but they were probably onto something, and it just never really got taken up, right? I mean, the thing that got in the health promotion world, the EP report was the report that came out in '86 that kind of laid out a vision for health promotion. And unfortunately, the only things that really got taken up out of that were very much about health behavior change, individual health behavior change, and the idea of environments. In fact, I think the theme was called creating supportive environments. And so it was very specific around creating environments for behavior, and I don't think that I would be quite as specific about that. Environments would be defined very broadly. In healthy places to live, work, and play is one way of thinking about it. And as I said, more of an action orientation, particularly with a focus on knowledge mobilization. And I use that term quite deliberately. The term knowledge translation, I think, is not necessarily the correct word for the breadth of things that I would want to pursue. And the knowledge translation metaphor, I think, has some challenges with it. Okay, so the thing that has influenced me most about knowledge mobilization and the opportunities that exist for the Institute is this really interesting paper that Patrick Fafard wrote in 2008 for the Canadian Policy Research Networks. Patrick is a political scientist who worked in government for quite a long time, and now he's at the University of Ottawa. And he wrote this paper where he basically outlines different models of how research can inform public health policy. And it was really kind of an overview paper, but the one model that he outlined, which in a way is kind of embarrassing to people in the health sciences because it comes from undergraduate political science, is this one. And it's astonishing how naive people in the health sciences are about the policymaking process. So this model basically says that there are 5 stages, and the first is agenda setting. The second is policy formulation. So once something is on the agenda, what are your research could inform the formulation of different policy options. And then once those options exist, that research could inform the choice of which option to pursue. The fourth one is about policy implementation, so that once a particular direction is chosen, that there may be research to support the implementation of certain kinds of policies, and I can talk about that. And then of course evaluation as well. And my thinking is that there's opportunities for people on campus to get involved in more of these stages and do so more explicitly with partners. And that this is a way of engaging partners from outside campus, and also a way of engaging people within campus to think about how they might place their work in ways that are going to be useful. So I can give some examples of that in a minute. With this model, the Institute would be better able to target activities for the greatest impact and expand the scope. My own experience with this is I ended up working on a project on policy, which was actually a policy implementation research project. And it wasn't until I was partway through that I realized what I was doing, because I read the Fafard paper when we were partway through it, and I went, oh yeah, I knew there was something different about this project. This is a policy implementation project. Almost everything I had done before, I would say, is agenda setting, right? I was trying to look at the impact of, so John mentioned that I do stuff on housing. I was interested in the impact of housing interventions on health. And the idea being that if we found some relationship, that would be enough to get some more attention on the political agenda for housing, because it had an impact on health, right? So most of my work had been agenda setting, and I'll tell you, as a journal editor, I would say probably 90% of what we publish falls into the category of agenda setting. And the degree of knowledge mobilization that takes place is really, a paragraph or two at the end that says somebody should really do something about this because it's really important. And we need more research, of course. As well. So anyways, the point is that I think there's some opportunities there. The policy implementation project that I was involved in, where I kind of had this aha moment, was with the region of Peel. And the region of Peel has put a great deal of emphasis on built environments. And they, well before I got involved, directed their medical officer of health, the counselors, the regional counselors, the elected officials, directed their medical officer of health to work with the planning department to find a way to build more active communities, because they were concerned about the fact that they were adding, the region of Peel adds 28,000 people, new residents a year, which is an astonishing number every time I say that. And they said, we want to be part of the solution, not part of the problem. We don't want to keep building sprawling suburbs that are essentially perpetuating physical inactivity. So we want to be part of the solution, not part of the problem. Now the interesting thing is that so things got on the agenda, and then prior to my involvement, they decided they looked at their options, they decided which direction they wanted to go, and by the time they came to us, they collaborated with planning, they said, we want to do this through the planning application process. So when somebody comes to the region, a developer comes to the region and says, I want to build a new community, we want to have a screen on those applications that is evidence-based, that says, will this build a community that encourages physical activity or discourages it? And so our work was about policy implementation. So we developed an empirical tool that could be applied to those applications, so that essentially the regional municipality can make decisions about whether they wanted to tweak the proponent to tweak the application, and in what ways, and so forth. And so now it's actually required when for developers in the region of Peel, is they have to do a health background study, and the central piece of it is this tool we developed called the Peel Healthy Development Index. And so that, I think, is a model for the kinds of ways that people get involved. Evaluation, I think, is a little more straightforward. Lots of people are probably, especially at CHEPA, are involved in evaluation kinds of activities. So that's the model is sort of guiding, or one of the models guiding the knowledge mobilization part of it. I would suggest that prior to that, in academia, we also have to have discovery in the broadest sense, and so that, in fact, it would be a 6th stage of this. So the role of the Institute would be to help identify opportunities in this continuum, help to build teams internally, establish and maintain external relationships, and then raise and maintain the profile as a go-to institute for questions related to these issues. So some of the knowledge mobilization vehicles that are either exist or could exist. So one that I've been developing that's now got a little bit of traction is something that we've internally been calling the Hamilton Urban Leadership Coalition, HULC. It's probably going to change names, actually. I think it's going to become the Hamilton Anchor Institutions Leadership, so HAIL. But basically, this is meant to be a cabinet of anchor institutions for evidence-informed intersectoral action on complex problems, and the main one being concentrated neighborhood poverty in Hamilton. So it's a response to the Code Red, and it includes the CEO level decision makers of the hospital groups, school boards, the city manager, the Hamilton Community Foundation, the chief of police, medical officer of health, so on and so forth. So those kinds of folks about essentially how can we coordinate and synergize our activities more effectively. I think the Health Forum is another, this actually was an outgrowth of a McMaster Health Forum that I co-led with people from the city and the McMaster Health, and the Hamilton Community Foundation. And so I think the Health Forum has a lot of value for this. And then another idea that would have to get some funding would be something of an urban health observatory. A lot of institutions around the city are involved in tracking changes in various kinds of indicators related to environments. The city wants to redo Vision 2020 and do Vision 2050 now. So the city's had this this sustainability plan for several years called Vision 2020. They want to renew it for 2050. So I think there's an opportunity potentially to do something there. And that actually fits nicely with a CFI that Jerry Hurley's leading out of social sciences to gather administrative data from municipalities and make it ready for research. So I think there's some opportunities there. And then of course workshops, public lectures, social media, etc. are other kinds of things that can be done. I mean, I've got lots of things that are related to this, but I guess I just wanted to emphasize that my view is that knowledge mobilization is a lot more, and people in the room will obviously will share this view, a lot more than making sure your study gets in the right person's hands at the right time. It's actually about synthesizing this knowledge for them and kind of putting it in ways that are useful to them. And it's not even written necessarily, right? It's about, ultimately it's about relationships. So there you go. So in terms of education and training, I mean, this is a research institute. It's funded primarily by the VP Research, but I think there's still opportunities for graduate students in particular to get involved in more research-based sorts of things, and I want to try and encourage that, and the question is, what's the right vehicle for that? Previously, thanks to John, the MIEH had a successful certificate program, and my view is that this is probably eclipsed completely by the MPH that CE&B is now going forward with. They're actually in the process of hiring a director for an MPH that's intended to start in September 2015. It probably was eclipsed by the existence of MPHs at 4 or 5 other universities in the province anyways, because the MPH just has a lot more cachet as a designation than the certificate would have, as much as the people who've gone through the certificate swear by it, and I keep running into them actually, who talk so fondly about it. But the fact of the matter is, I think that probably that's behind us. The Institute is working closely with the development of the MPH, and is also, which is also related to the community medicine residency, and the MIEH actually has a seat on the advisory committee for the community medicine residency. So all of that makes sense, and there's lots of synergies there. One of the ideas, and it's interesting because this kind of came out of the previous director, Bruce Newbold's, it was actually his idea, and I don't even think that he thought of it as becoming a thing, if you like. So a couple years ago, Bruce said to me, do you think you could do some kind of a professional development course, say 2/3 of a day or something like that for people who work in housing and health? And I said, yeah, okay, sure, I could do that. So I worked with the staff person in developing this, and we held it at the Burlington campus, which in my mind made a lot of sense because you might potentially draw people from the broader GTA, and it was made even better by the fact they didn't charge us rent for the room. So basically, and we charged people a pretty reasonable amount, fed them and everything like that, and got about 30 people, and it actually worked out beautifully. And so what I'm trying to do is make that now into a regular thing where if people are interested in getting the kind of work that they're doing in the hands of more frontline kind of practitioners sorts of people as a professional development activity, there's all kinds of opportunities related to that. So, and I can imagine that there are pretty big audiences for that. The key, I think, is to make it as easy as possible for the faculty member to do that, and from an organizational standpoint, which basically means we would handle everything, you know, in terms of registrations, bookings, et cetera, et cetera. All they'd have to do is show up and deliver the content. Now, the more difficult thing is get them to deliver content that is going to be suitable for more of an adult education audience. And the thing I despair about is somebody showing up with 150 slides and just running through them, which is probably what I did actually in the first one, looking back on it. So, so anyways, we're in the process of trying to get an OISE intern to come and develop essentially a number of different modules that people can draw upon and create activities that they can put into these, to the programming of these sorts of things. And the idea is that we would pay the person an honorarium for doing this. There's also PhD diploma programs all across campus, and so there's a possibility there. And then we actually tried to pull off a graduate student conference jointly with Health, Aging and Society, the Institute, and the Gobrea Center in the winter, but we got started too late and it didn't work out, but we're going to do that again this coming year, 2015. 2015? Is it that late? Yes. Okay, interdisciplinarity. I can see lots of opportunities around. It's, you know, this kind of research is taking place in many disciplines. The terms of reference for this institute say that you have to involve all the faculties, and certainly I think there's some more obvious ones, but social science and humanities I don't think have been involved very much, well maybe, I'm not sure. At one time they were, but you know, it waxes and wanes. And so, so there's some issues around governance I think related to that. I've been going through and having meetings with the Associate Deans of Research and all the faculties to get their input and suggest people that I should be connecting with. I think like to be able to support signature projects where people are brought together across campus around a particular idea. And then I think there are some opportunities in some areas that might not be normally considered, including communications in the School of Arts. And then all kinds of large studies that are in existence that have some possibilities as well. Some of it is actually about kind of negotiating what's the boundary between, say, what do all the water people do, because there's so much capacity for research on water on this campus right now. It's incredible. I mean, effectively, McMaster has become a water university at some level. And so, you know, what's the boundary between what they're going to do and what we're going to do, because it's not always about health, but some of it is. And then internationalization, this is something where I really need some help. One of the things that exists is a Fulbright visiting chair, and I think you've had a couple of those that you've hosted in the past. Yeah, so the uptake on that doesn't seem to be really strong, and the ones that have come across my email in the last few months, they haven't had strong connections. So basically I think people wanted to be in the area, and really it was a little more than that. So I think there's some opportunities there. And then I think there's some opportunity for comparative research, and then best practices research. In fact, Holger Schoenemann does a lot of this related to best practices in environment and public health. And then some potential opportunities for professional development at conferences, so workshops, pre-conference workshops and that kind of thing, in the kinds of, using the same work that went into the development of these professional development workshops. So that's kind of a very quick overview, and I just really wanted to open a conversation about what we might do and any thoughts that people had. I can see lots of opportunities. One interesting thing that I will mention that's not represented in the slides, and it's taken me a while to bend my mind around how this works exactly. So the Institute has a really, what seems to me, superficially at least, unusual relationship with the Public Health Department in Hamilton. I think you started this, John. And so basically, the Public Health Department pays us to hire someone who spends all of their time, so they're a research coordinator at McMaster, they get their paychecks from McMaster. They spend 100% of their time working downtown with the Public Health Department. And initially this didn't make any sense to me, so why don't they just hire them directly? And so there's lots of reasons it turns out that that is the case. So one of the But nevertheless, I think there's some opportunities related to that, because essentially what this person is doing is helping them with implementation research. So for example, they decided recently, the city of Hamilton decided that they're going to do a restaurant inspection system, and so so the public health department had to implement this, and the research support came from Marie, who's the person who does this. And so, and then the evaluation is taking place. So I think there's some great student opportunities for projects related to that if you're interested in something about policy implementation. There was also some really good work done on Legionnaire's disease as well a few years ago. So, so there's lots of examples of those kinds of things. And what I'm hopeful is that, and I've already talked to the medical officer of health about this, is trying to expand the scope of this relationship so that we might also be able to collaborate on some things that are a bit more strategic, so a little more on the agenda setting side of things. On big issues that they are having a tough time getting onto the agenda, but with the support of the university and all that comes with that, might have an easier time getting onto the public policy agenda. So there you go. I'm going to sit down so I can take notes. Thanks.
Well, thanks so much, Jim. So we'll open up for questions and reactions. Potential linkages to CHEPA, maybe.
Well, maybe I can start with a question on, the institute is mostly some kind of a virtual institute, would you describe it like that?
Yeah.
Okay, so there is no actual building.
There's a cubicle.
There's a cubicle.
Yes.
And, okay, and you're not in that cubicle, so you're...
No.
Okay.
It's virtual, yes.
It's virtual, okay. An institute means, what is, for instance, well, CHEPA is a center, the institute is an institute. What difference would that make?
That's a good question. I'd have to, it's on my list of
Things to understand?
Yeah, well, it's on the list, the not written down list of things that I need to understand. But my understanding is that an institute is supposed to be somewhat more elaborate than a center. But I would suggest if you compared MIEH and CHEPA, that doesn't play out that way.
Maybe governance is different, or you have...
Well, resources and people's attachment to it and that sort of thing, I think is different, the way that people are attached to it. I mean, that's the other thing too that has to be, that I have to work out, and I'm currently working with an idea that there would be kind of 2 levels of membership in the institute. So there'd be people who are associate members, if you like, and some people who are more core, and there are going to be obligations, I think, with being a more core member, which mild ones. Because it's not like I have anything to give in return. But people who are leading initiatives and who are actively working on issues are one thing. But I want to avoid the idea of just having a list of people on a website. I'd like to be a little more active in that. That might be overly optimistic, I recognize. So.
Yeah. And
so yeah,
there is one question. What is the membership so far?
It's a large number of people who have been affiliated for the most part for a long time. And so part of the job is also to go out and find new people. Because my hunch is that probably there hasn't been an active refreshing of the membership for quite a long, for at least a couple of years. In part because I've been in this for 6 months. It sat vacant for a few months, and then and I think probably there was a transition year that was going on the previous year where it wasn't uncertain whether the VP research was going to continue the institute or not, as Bruce's term was expiring. So we're probably at least 2 years behind in
membership,
and renewing membership, right, as new people come on campus, that kind of thing. Yes.
Kind of a follow-up to that question. What are there any mechanisms for coordination, collaboration, and forming of activities? Since it's very multidisciplinary, interdisciplinary, I saw the list on campus of who's involved in the institute. But how will people know what everyone else is doing, and how is there kind of a collaboration? What's your vision for that to make that happen, so people actually do get out of those silos?
Well, I'm hoping that that we can come up with some theme areas where people are working, and that people can kind of affiliate to those, because I think that affiliating to something as broad as environment and health, or healthier environments, is so big and broad that at some level it becomes meaningless, right? Because if it's everything, then it's nothing, kind of thing, right? So basically there's I've got some ideas for some of the themes that might be areas of focus, but not exclusive, right? In the sense that it doesn't mean that we would exclude anything that's not specifically in an area of focus, but would like people to affiliate to those areas of focus. So, you know, one of the ones would be around built environments, and I think certainly the transportation people in the jobs department would be obvious ones related to that. But and then I think another great opportunity, in part because they're going through the same exercises, the Offord Center for Child Studies. I think there's some opportunities there for them, and their affiliations are strong with pediatrics and psychiatry and behavioral neurosciences, and both pediatrics and particularly psychiatry are really interested in getting into the area of disparities, right? So there's, I think, a great potential for looking at kind of environmental health equity. And when I say environmental health equity, I mean it in the broadest sense, right? Not just exposure to pollutants and that sort of thing for kids, right? And the healthier environments for kids could be something that we could work on something like that. So that would be something that people could affiliate to. But any other suggestions you have? I'm like
water. I'm not actually on campus, but
water.
I would say water.
Yeah. So I mean, water is going to be the tricky one because there's
so many dimensions of water.
Well, not only that, there's a ton of capacity on water already.
But there's not a lot of capacity on water and health, to my knowledge.
Is that right? Okay.
Linking the two together and actually doing health-based studies on water and health.
Or in social sciences, no?
Yeah, and linking social sciences.
With water.
Well, there's a new chair, right? In
water policy chair.
yeah, there's a new water policy chair, right?
Yeah.
Joint between engineering and
I think
social
it's
science.
quite, it's more on the social science side, but we're on the water and specifically health side, looking at kind of epidemiological interventions, but related to water and climate change. It's my area of interest.
Okay.
Yeah, I'm biased.
And then UN University.
Yeah, and the UN University.
They're not doing that sort of thing.
Yeah, they do some, but I don't think there's a lot going on campus.
Okay. Well, help me understand. So, just while we're having this conversation, so, I mean, what's the role of an institute if the thing that needs to be done is epidemiological studies on water exposure and health? Then what's the role of an institute in that?
It's linking the engineers who might do the water quality analysis with the people, the epidemiologists who know how to do the health-based studies, and those people talking together to then talk to public health people at the public health agency on how to then implement policies around, for instance, private wells and people who don't manage their private wells, but we know there's disease risks.
Yeah.
Yeah. That's just a very specific example, but to try and illustrate a point.
Yes, and I've struggled to find the epidemiologists on this campus who do that kind of thing. So anyways, we can talk more about that. But I have yet to find, that's not what I'm hearing coming up, is that those people exist.
No,
but I am hearing that kind of issue about wells and fracking, water fracking, as well as the other. Yes. Yeah, go ahead.
I don't work on water, but the new water chair, Dustin Garrick, is actually housed in our department in political science.
Yep.
And I would recommend getting in touch with him because he's very interested in building up the policy and the social sciences side of water research and making linkages with other people on campus. So he's very energetic.
Yeah. No, he is indeed. Yeah.
What's the being enthusiastic?
What's that?
No, it's all right.
No, I know. Other thoughts, John?
Yeah, well, let me make a
Please do.
comment before we get back to 1939 and Farris and Dunn, mental health in cities.
I like the classics too.
Oh, it's around. I think, in some ways, what you presented was a blunderbuss approach, right? You know, where intends you and where you'll go. And I think that's right because you have to be opportunistic in terms of where funding is possible. But you know, those themes are going to have to take a key role as you move forward, talking with other people. You can't do everything. Yet the title suggests you're going to do far more than the old institute did. So, to grow the institute, what incentives can you offer?
Yep.
To people. I mean, in the past, and it may not be possible now, we used to offer assistance with putting together research proposals, you know, especially if they're multidisciplinary. Just someone to do that legwork and all the form filling, and so on. So, for me, that would be a large incentive. You know, someone who can actually, input material. Climate change has one. McMaster Centre for Climate Change has a person like that. Who takes a lot of the stress out of putting in those major applications, and the institute can then maybe take credence for her, take credit, sorry. But also may gain something, in terms of resources, for providing that assistance.
Yeah, I mean the resources are limited, and it's not like I can give up money.
You give up time then.
I can give
Time
up.
is
The
just
only
as
thing I
important as
have,
money.
is giving up money, is giving up time. And need to coordinate more with Rose. I think about that.
Good luck.
Thank you.
So when you say to give out time, what you mean is that
Staff.
so it's virtual, but so there's one cubicle, but there's
a staff person.
Staff.
There is a staff person.
There's a staff person, and that person could do that kind
That's
of
right.
legwork and.
Yeah.
Okay, but then another question: if it's, let's say, an institute that works with and tries to build interdisciplinary research, then you have this, let's say, this issue of the PI belongs in one faculty, and so how do you make sure that, or how do you convince people from various faculties to work together, knowing that at the end of the day, the PI or the faculty where the PI works will get the credit, or most of the credit, or maybe, or even not only the credit, but even the funding is going to go overheads, or going to go to that faculty or stuff like that. I don't.
Well, they go also to the VP research, right?
Well, the VP research is getting a fixed amount
Yeah.
now, and under the new budget model.
Yeah.
I mean, I think that, the justification is to the VP research. I mean, ultimately that's, so this, there are very, very few institutes that report directly to the VP research, and this is one. All the others report through a faculty. And so, so my accountability is to Mo, and if I can document to Mo, like, well, I've done the things that this institute which is supposed to do, which is involve all the faculties and create interdisciplinary activity and do knowledge mobilization, which Mo is very big on right now, then I don't imagine I'll get any more resources, but he won't take any away.
You should ask him to incentivize it, just his own job is incentivize it. Seriously? He gets extra pay if he does X. Why shouldn't the institute get extra resources if you do Y? It's an argument worth making.
Well,
Good luck with that.
I've tried that to make it explicit up front, but he's taken well, let's wait and see. Oh yeah, if you do that, then we can talk about it. It's been so far. Other thoughts? Yeah, go ahead.
Sorry, I'm not sure if you mentioned this in your presentation, but where are your graduate students from? What kind of courses do they take, or how
I
do they
think
become affiliated
that's the
with
thing, is there is an
institutes?
affiliation to graduate students right now, so
Okay.
those are more just ideas. So I think, the water example, again, there is this PhD diploma, and I think that's certainly a possibility. The conference that we had started to organize between the department where both Michelle and I are based and the Gilbray Center on Aging and this institute was, I think we were calling it Aging Health and Environments or something like that. So trying to create a pretty broad swath of people across multiple disciplines to come. And, it might be one, I know I thought of a lot of things about how the world has changed since 1989, and that might have been one that I hadn't thought through, because I was a little surprised at how, I would have thought there'd been a lot more interest than we got even on relatively short notice. But I think people got the impression, just from the interactions we had with some of the students who had expressed interest, we had a lot of people register, very few people wanted to present, which was interesting. And so apparently we didn't do a very good job in communicating the idea that this was going to be a safe kind of student only. You can't embarrass yourself. Well, you might, unless unless you really try hard kind of approach. But I'd love some input on that too.
And just when, the students who registered though, but where do they come from? Like what kind of?
In that particular one, we kind of cast a sort of 3-hour net around McMaster and approached any department we thought was relevant. So almost any department in the social sciences, the kind of, health studies, health sciences programs, essentially those were the big ones.
Any other questions?
Any other thoughts?
To share with Jim?
Yeah, well,
I mean, does anybody see any mileage in? I mean, Center for Health Economics and Policy Analysis. I guess first of all, a lot of the issues that come up could certainly benefit from some economic analysis, and these are particularly public health kinds of issues. And then in addition to that, I think there's a lot of opportunity for implementation research. So, like the kinds of things that are coming out of, even just a restaurant inspection thing, there's a paper to be written there, and I'm not, could I write it? In principle, if there was more than one of me, then I could. But the point is that I think there's a great opportunity, and the person who's doing the research is, really just has enough time to be able to support them to implement the policy. So the idea of then taking it a step further and actually writing up as a paper for publication, I think is a great student opportunity. So do you think there's possibilities to link with CHEPA in that respect?
yes, well,
Okay.
the answer is obviously.
Sure. I mean, I guess the PhD in health policy is another.
That's, that goes through CHEPA, that
Yeah,
would
sure.
go directly to the PhD itself, and what I would see is that obviously I don't think we had that kind of connections with, let's say, anything beyond health.
Yeah.
So we have connections with the links, we have connections with Hamilton Health Sciences, but typically with restaurant inspection, I don't think so. Correct me if I'm wrong.
Yeah, well, that's a public health function. Yeah.
And surprisingly, maybe we don't have that many connections with public health.
Yeah.
Even though we are, let's say we're CHEPA, but CHEPA, I guess there is more emphasis on health care,
Yep.
maybe, than public health. So obviously there could be opportunities here to work together on that.
Yeah.
Certainly people in public health might be interested in what CHEPA can offer, and we are interested, CHEPA, in exploring those avenues that so far haven't been explored. Well, John, correct me if I'm wrong here, but I think that, or at least that's the impression I get, that CHEPA is much more, let's say our natural connection is with the Ministry of Health.
Yeah.
Typically.
It's the nature of health sciences here. The whole faculty is not strong in public health,
Yeah.
despite the fact they're going to create a master's in it.
Yeah. That would be accurate.
Thank you.
It will be a small group. Now, there's another. I think that's one of the natural. That would be the natural student group. I think it will be the MPH people, the students that are coming through for an MPH, and that some of the implementation research that's taking place in public health, there will be students attached to those kinds of activities. But again, MPH students doesn't necessarily get you to publication. And I mean, I think it's some low-hanging fruit, right? Particularly if somebody has broad interests in policy, there's low-hanging fruit there, right? Because there's a staff person, there's a policy that's actually being implemented, right? Which is as you speak, and the staff person's done a lot of the legwork, and then there's potential for a student to be involved in that as well. And so it really just needs some kind of faculty oversight to be able to get things out the door in terms of publication. So I think, to me, that looks like that lines up to be low-hanging fruit. And I think in the past, you were doing a lot of that,
Yeah, and
marshalling that through.
And Bruce then
And Bruce took it over, right?
Probably in a larger way because of the changing role of that research assistant in town, because it's now 0, 100.
Yep.
It used to be 100, 0
Right.
when I was director, so
Right.
we got the money and the resources.
Right.
But there was a need to change because of their agenda changed.
Sure.
But yeah, so it does require that faculty oversight. got so much on, trying to redevelop this that it can't.
I don't, well, it doesn't make any sense for it to go, it wouldn't matter whether it was me or anybody else, I don't think it, the way it is now with the 0-100, as you say, it
And restaurant inspection.
well, I guess it wouldn't be the top of my list either, but on the other hand, you get that published,
I know.
right? And, I don't know whether it's true or not, but the research coordinator there says that what they did on Legionnaire's disease was actually really advanced. Well, if it is, then great.
They don't
You
get
should publish it.
on air quality as well.
Yeah, actually, I had a meeting with the air quality people
Yeah.
last week, and they are they're amazing, doing amazing work with some amazing data. So, so anyways. And I think there's just even a lot of policy stories to tell inside public health that aren't getting told because there's not a lot of, compared relative, the number of people who are health policy and health service researchers compared to public health policy researchers is, they're dwarfed, right? The number, I don't know, I could probably count on one hand the number of people.
Here, certainly, other universities have a different
Yeah,
profile.
even in Canada, I know.
Those that have a school of public health
Yeah,
are
fair enough.
more likely to have more
Yeah.
public health researchers than
Yeah,
ours, which is just faculty of health sciences at the present time.
yeah.
Do you have much connection with, because public health hasn't really been a major government initiative either, so do you do much connecting with the people who actually work in public health, who maybe aren't connected with the university, but who do interesting jobs or have a lot of knowledge? Like, is that something that you
Yeah.
would be doing?
That's essentially who we work with.
Like the public health nurses who are, or whatever.
Well, the people who fund and run the programs, oversee the programs related to public health nurses, yeah. It's currently the arrangement is with one division of public health, but I think there's other opportunities to branch out. But so yeah.
Have you, just to follow, I think that's the next one, have you had a chance yet to talk with the public health medical
Ontario.
officer? Ontario. Yeah.
Public Health Ontario.
Yeah.
Well, they're headless at the moment.
Oh, is
As
that
you
right?
know, yeah, Vivek quit.
Well, I didn't know that.
Yeah. He's going to California to head up some.
So,
He's a surf, yeah. No, to head up some. It's a not head up. Sorry, in the executive of a private company that's selling learning systems to universities across the world. So there you go.
yeah,
He's a go.
MOOCs or
Sorry.
is it
Yeah,
MOOCs?
MOOCs.
Okay.
But it's on my list. I work a lot with Heather Manson already, and then but I need to talk to Ray. Certainly, those would be the two portfolios. So Ray Copes does environmental health, and then Heather Manson does chronic disease and health promotion. So those two people for sure.
It's a provincial medical officer of health.
Oh yeah, no, I work. I do a lot with her already.
Who's that?
Arlene King.
Okay, yes, sorry.
So and actually, to be honest with a lot, so Arlene King a year ago released a strategic plan for the public health sector. That's another challenge, is that public health in the broadest sense is a sector as opposed to something unified and coordinated. And there are 5 collective areas of focus. And I don't know why themes seems like it was a taboo word, so they use collective areas of focus. And one of them is on environments built and natural. And so there's an implementation, what I call an implementation committee for this environments built and natural, and I am on that. And it's met 2 or 3 times. So yeah. I'm looking at it.
But I'm sorry.
Yeah.
But funding for that would have to go through the MOH competition processes, yeah?
I think so. The MOH is applying for their.
No. The Ministry of Health has
Yes.
its research competition.
Oh, their research competition. Yeah. So that's.
So it would be again diluted by other themes.
Yes, absolutely. Yeah. There's no explicit research funds attached to the implementation of the public health sector fund.
So implementation research, that's what the ministry would call applied health research question, or would you see that as different? Is it so you're contacted by somebody who would like to implement something or have a really applied question, or Is it more specific? Is it?
I think that what the ministry calls applied health research questions could happen across that entire spectrum, right? So they, somebody could call you up and say, listen, we've had a number of, I don't even have a good example, but, we've been hearing around the community there's people are having symptoms related to exposure to this or something like that. Is there any evidence that this is valid? Right, that could be an applied health research question, but it's not an implementation research question necessarily, right? It's like, is this a problem? Is it something that we should be trying to put on our agenda, kind of thing? So I can imagine you could have applied health research questions at every level.
Okay, any final comments or questions?
Thanks, everybody.
Well, thanks so
Drop me
much.
a note if you think.
Thanks so much, Jim, for sharing those thoughts with you, and
Yeah.
good luck with the process. Yeah.
Thank you.
Yeah.
Okay.
Trying
Thank you very much.
Trying to be